Hi, this is Dr. Darren Schmidt at the Nutritional Healing Center of Ann Arbor, and I'm going to go over some lung support products. I'm also going to go over a couple of resources. I got two books I'm going to talk about, and this video is shareable with people who are interested in herbal and nutritional supplements for any reason, but especially for lungs with this particular video. So please share it with any kind of lung support group on Facebook or on Reddit or something like that. And I'll give you a couple of resources then too that you can acquire for further knowledge on using herbs and supplements and any contraindications with medications. So I have some personal experience with lungs myself. When I had black mold poisoning, it settled in my lungs, and one night just as I was falling asleep, I would go as I woke up. This happened about 5 times over the course of 2 hours, and I know what it's like to not be able to breathe and not know why, and then you have to go on this journey of trying to fix it. So I have some supplements here. I'm going to go over this, but you still have to think in these terms when it comes to lungs, just like any other organ. You got to find out the cause. If you have worked in a dusty place or worked with metal shavings, welding, in a factory with fumes, chemical fumes, you got to clean that out. Those are the toxins. If you have a chronic fungal infection or a bacteria or virus in your lungs, that can cause problems, of course. You got to kill that off. And you can have trouble breathing because you've been eating too many carbs and now you've gained weight. Or maybe you're still thin and you have congestive heart failure. And the excess sugar can cause difficulty breathing. So there you go. You got 3 major causes for lung issues. And then lactic acidosis, dirty blood. And you can see my other videos about that. But let's talk about therapies for the lungs specifically. So I can start with some glandular therapy. Standard Process has this product called Pneumotrophin PMG. PMG stands for protomorphogen, which back in the 1920s was coined around the same time that DNA was coined, like those terms. But the PMG term did not take off like DNA did. So the protomorphogens, the PMGs from Standard Process, cover this, stem cells, DNA, and glandular therapy. So Standard Process has every organ represented. They got skin, they got eyes, they have brain tissue, muscle, specifically heart, liver, thyroid, spleen, etc., etc. So pneumotrophin does 2 things. Number 1, it nourishes the lung tissue, and number 2, it stops the immune system from attacking the lung tissue. So if your lungs have been falling apart for too long, we're talking like a couple years maybe, could be shorter, could be longer, the tissue's breaking down, the immune system starts to attack the dead lung tissue. After a while, the immune system gets confused, and it also attacks the live lung tissue. So this pill acts like a block, if you will. The immune system starts attacking the pill, and it gives your lungs a break so that they can start to heal. Plus it has the nutrients in there too to heal. All right, I'm going to go through some what I call drainage products. This is called Fengree from Standard Process. It's got fenugreek in it, which is an herb that pushes things out of your body. So this one pushes stuff out of your lungs and your sinuses, and the postnasal drip from, you can have sinus trouble, continual mucus creation dripping down the back of your throat, causing a dry cough, but it's reinfecting your lungs, or it could be reinfecting your stomach or lower other parts of your body. So Fengree stops that postnasal drip, and it can get rid of allergy reactions too, seasonal allergy problems. Speaking of which, this is called Allerplex. This is more designed for the lungs than the Fengree is. And lung coughing and irritation from seasonal allergies, this is really good. It also has fenugreek in it too, and other herbs. So, and organs from animals. All right, here are 3 herbs I want to go over that fits in this category right here. And this is called Pulmico from MediHerb from Australia. So Pulmico is more for the emphysema, chronic autoimmune situations, and chronic disease conditions of the lungs. And these MediHerb products are a combination of several herbs most often. So Chinese skullcap and turmeric and ginkgo and fennel and 2 other things that I can't even explain the other 2 things. So it's a complex of herbs that work really well together. And And then Resco, think of it like rescuing your lungs from congestion and infection, although in the natural healthcare world, we can't use the word infection. We can say congestion, or we can talk about draining out the lungs. And again, this is a complex of herbs, including licorice root, which could raise your blood pressure. So if you have high blood pressure, you can't take Resco. Licorice is commonly used too for adrenal problems, adrenal fatigue. And I'm not going to read the rest of this, but you get the idea. So that Resco is more for chronic mid to lower congestion. And this is bronchitis, which is more for acute mid to lower, mid meeting here and down in the lungs, more for acute situations. So this is called bronchitis from MediHerb. And how do I know all this stuff? Because I'm really smart, but yeah, that's true. But here's the other reason why. Because I got this book and I look everything up. I'm using this book almost on a daily basis. And you can get this from ifnh.org. Anybody can buy this. You don't have to be a doctor to buy this. And I talked to John Brady. He's the guy that runs the International Foundation for Nutrition and Health. That's ifnh.org. And I had said in a video a couple years ago that the USDA will change this, or the FDA is going to go through this and they're going to change the wording to make it more FDA legal. That's not a true statement. John told me that since the foundation is completely separated from any nutritional supplement company, including Standard Process or MediHerb or anybody else, that they don't have any legal bearing to be FDA compliant, because the IFNH doesn't sell any supplements. They only sell educational material. So you can buy this and you can have it and you can run through here and learn about the supplements yourself and work with these things with your family, or maybe even be employed by a natural health care practitioner, chiropractor, acupuncturist, somebody who sells Standard Process and MediHerb. And they have fundamental axioms, natural laws, if you will, on how to heal the human body, even if you don't use these particular supplements. So that's the clinical reference guide. Now, I had mentioned that there is the contraindication of taking licorice if you have high blood pressure. And if you have any other questions related to herbal interactions with drugs, the best resource for this is actually MediHerb. And here's this book, and it says in faint font right here, Contraindications and Cautions for MediHerb Botanicals, right there. And so as you flip through this, they have the name of the herb, and then any contraindications, cautions, and potential adverse reactions and interactions with drugs. This is the best resource worldwide for herbal interactions, negative interactions with drugs. Now, there are other associations and organizations that try to be a resource for this type of information, and they don't come close to what MediHerb has done. So having said that, when it says there's a contraindication, that means that it's a contraindication. Don't combine the herb if the person's on a medication. If it says caution, it's okay. If it says upon the advice of your healthcare practitioner, it's okay. If they say caution with pregnancy, it's still okay. The word that really matters is contraindicated. So that's just some languaging that you need to know about when you read through this type of material, so that you know what the truth is and what, they're just trying to cover their butt to. So there you go. There's some information on helping out your lungs with supplements, and then a couple of resources that you can acquire for your own knowledge. If you like this information, please give me a thumbs up, share, subscribe, hit the bell for notifications, and please share this with people on with Facebook groups that have lung issues, or share it with friends or family that have lung issues and they need to breathe better. I know how crappy it is when you can't breathe.